Hello, I'm Dr. Lawrence Broder, MD, owner of Beleza Medspa with offices in Austin, Round Rock, and Cedar Park, Texas. After watching tonight's episode of Real Housewives of Beverly Hills and seeing Suzanne Somers, how good she looks, how great she feels, you must have a lot of questions about bioidentical hormone replacement. I'm here to answer some of those questions. So, what is all this interest in bioidentical hormones? Bioidentical hormone replacement therapy seeks to restore to the body what is missing in the face of stress or imbalance. As we age, hormone levels naturally decline, leading to various symptoms and a general decrease in a feeling of well-being. This is a normal part of aging. Bioidentical hormone therapy makes use of hormones that are identical with what the body produces instead of making use of pharmaceuticals and herbal supplements. Drug companies cannot patent bioidentical hormones, so they synthesize artificial replacements. This is what we have used for years, these artificial replacements. These commonly prescribed pharmaceuticals function differently from natural hormones and lead to side effects and decreased potency. There is a precedence for bioidentical hormones as both insulin and thyroid hormone are commonly used natural hormones throughout medicine. So how can bioidentical hormones help you? By employing bioidentical hormone replacement, normal hormone levels can be quickly achieved in the blood, helping to remedy any problems you may be currently experiencing. Common hormones that are measured include estrogen, progesterone, estrogen, testosterone, cortisol, and thyroid hormone. Conditions that we treat include premenstrual syndrome, polycystic ovaries, menopause, andropause, male menopause, adrenal fatigue, and hypothyroidism. These conditions that affect men and women of all ages. So how does this bioidentical hormone replacement work? Bioidentical hormone replacement works by replacing the hormones your body needs to function, and that can help change the way you feel from day to day. We use the smallest amount possible of bioidentical hormones to lessen symptoms and improve well-being. We follow up your therapy with testing to ensure that you're getting the right amount of hormones that you need. So what do you expect during this treatment process? To begin, we commonly use salivary testing. Why do we use salivary testing? Because bioidentical hormones are steroid hormones. So the way they work is they get absorbed by the tissues. They're secreted by a gland, go into the blood, and go to the tissue and get absorbed. When we draw blood, we commonly do this from the vein, which is the blood coming back from the tissues. So if the steroid hormone was absorbed by the tissue or there wasn't enough produced, we can't tell because we're reading the blood afterwards. Salivary hormone testing tests the saliva for a level of hormones that are equilibrate with what's in the tissue is seeing. So we're actually getting a very easy way to see what your tissues are actually seeing in terms of hormones. This, of course, is no blood draws needed, nothing like that. So it's a really good way of finding your hormone levels. Used for more than 40 years, salivary testing offers an accurate measurement of basal hormone production. This will be done at your very first appointment. After filling out a symptom questionnaire, a salivary kit is issued and you will complete your testing at home. When the results are available, a follow-up appointment is scheduled to correlate symptoms with measured hormone levels. Question you may have, I've heard a lot of bad things about hormones. Are bioidentical hormones safe? Most natural hormones are extracted from plant sources. Since they are not manufactured by drug companies, we depend on compounding pharmacies to secure them. At these facilities, professional pharmacists produce natural hormones in different delivery systems. These compounds are then available by prescription for replacement therapy. Synthetic hormones that you get from the regular pharmacy have many extra compounds and components that can increase the risk of certain cancers and blood clots. On the other hand, bioidentical hormones lack these extra components and are much safer as a result. Just like pharmaceuticals, bioidentical hormone replacement requires the same cancer screening procedures like mammograms, pap smears, etc. Furthermore, bioidentical hormone replacement therapy utilizes close monitoring of tissue levels. instead of relying on your symptoms, so not just saying, hey, do you have hot flashes anymore, but we actually measure your saliva levels. We tailor the dose given to give you the least possible amount of hormone to get the result. So the advantage is, one, we use a different delivery system. We typically use transdermal creams, which do not go through the liver, which keeps the hormone intact. Two, we use hormones that are very natural and safe. And three, we follow your hormone levels very closely so you don't get too much. How many treatments of bioidentical hormones will you need? Treatment is an ongoing process in nearly all cases, but we'll design a customized plan to meet your individual needs. We will have the bioidentical hormones you need compounded at a pharmacy. This may be a lifelong process, and many of these hormones have anti-aging properties. Of course, we will follow levels, and these hormones will be adjusted as you age. So if you're interested in bioidentical hormone therapy, I encourage you to come in for a free consultation at Beleza Medspa in Austin, Texas. We will do some testing and discuss your symptoms and try to match them up. But in terms of weight loss, energy, fat distribution through your body, building lean muscle, hormone therapy, especially for older individuals, middle-aged individuals, is unprecedented and will one day become the standard of care. Right now, you can be on the cutting edge of anti-aging. Thank you.